The most controversial and the weirdest thing that I have heard is that a vaccine causes autism.
Hey everyone, welcome to the Tired Parents Club, a safe place to share, laugh, vent, talk about the ups and downs of raising the littlest versions of ourselves. I'm Kevin Pinto, your host. We have Sierra Langford, our host.
Hello.
Sierra, what are we talking about today?
Hi, everyone. I'm super excited for this episode today. Today, we have with us Dr. Paxter. He's with Carolina Pediatrics, and we're here essentially to talk about all of the common illnesses that can arise that first crucial year with your child, and as new parents, what to expect, what to look out for, and just how to get through it, really.
Yeah. So again, if everyone who watches the show, I have Lila. She's 5 months old. She's just going through her sicknesses. We're in daycare right now, so she's gonna get sick a lot. And then you have Liam.
Yes, Liam, 2.5. So I've have my fair share of experiences at this point with my son catching a couple of things and getting through that. So yeah, Dr. Paxter, thanks so much for joining us today.
My pleasure.
Yeah, I guess our first question would be, when you have an infant, when you have a baby, like Kevin, he has a 4-month-old baby girl, what are just like the typical, signs of illnesses in infants? What do parents really need to look out for?
Typically, what we have is respiratory illnesses, so runny nose, cough, congestion, fever. But basically, parents are the best gauge to see what's wrong with it. When you know that there's something wrong with your child, you know that it's something that is not that common. They are not acting normal. You know, you have the gut feeling that there is something wrong. That's when you have to consult.
That's true, right? You do know your baby. You do know when they're acting a little funky.
It's like a fever. I always tell the parents that the best thermometer that there is the parents. You see you touch them all the time. So when you feel that they are warm, it doesn't matter what the thermometer is saying. If your baby feels warm to you, you have a baby with a fever, no matter what the thermometer is telling you.
Oh, well, yeah, that's true, I guess. Yeah.
That's an excellent point.
Now-
I never thought of it like that.
Now I've had, when, I'm a first time parent, right? So you just never know. You get nervous, right? I'm sure you get a lot of parents that are more nervous than people who've had 2 or 3 kids. But Lila, so I think she pretends coughing sometimes. Is that a real thing? Are babies fakers? Do they fake it for attention sometimes?
Well, the babies, if they see a behavior or they have a behavior that arises some response from you, they like that response, they are going to try to do that again to elicit the same response from the parents. But sometimes when they are coughing, sometimes they are just getting their saliva, their own saliva may make them cough. If it's not a persisting symptom, I don't think you need to worry about it.
Okay, yeah, I think she's a faker sometimes. I'm like, no, you're not getting me today. We're not going to the doctor. We're not doing all that stuff.
When should we to call the doctor or even go to the ER? I think sometimes parents hesitate.
Great question. I would tell you that the ER almost never. The ER is overutilized for things that don't need to be ER. The ER should be reserved for true emergencies. You have a significant fever. You have a child with something serious. Older kids with abdominal pain that will require surgery. Something like that does require an emergency room visit. But any kid who just has a little runny nose, a little fever, a little common cold should not populate the ER, because what you're doing there is just you're having so many kids with illnesses that do not require ER visits, but they are sharing all these germs and just giving them to everybody, and you're going to catch something else that you don't need. Also, it's an overutilization of the resources that we have at the ER. So someone with a true legitimate emergency cannot be seen because someone who could be seen by their pediatricians is being seen at the ER. So the best advice that I can give you is find a pediatrician that you have a good relationship with, that you have good communication with, and when you have any of these questions, direct them to them. And when your pediatrician tells you to go to the ER, then you listen to them. Then definitely you go, but do not go without the advice of your pediatrician.
Because I do have a pediatrician, right? And they have a they
I
have
would
an
hope
on-call.
so.
Yeah, of course. They have an on-call person, right? Essentially.
Mhm.
So I've called the on-call. I don't know if there's a charge for it, as far as I know. So I'm like, hey, if we have access, why not give them a call if we're really
Yes,
concerned, right?
that is
It's
the
a
best
better
approach.
option
I
than
always
bringing them
ask
in.
my patients to call us first, and we direct them. Also, we tell them what emergency room is the best. For example, if there is an orthopedic injury, where should they go that there will be less of a wait? If they just need stitches, which is the best place to go? Or if an urgent care will be a better option for them. So it's not always a clear cut. It's always, if you have the advice of somebody with more experience that can advise you, that probably would be the best choice.
Do babies know when it's the weekend? Because I feel like they get sick on the
Unfortunately,
weekend.
not. No, also they don't know when it's 5 p.m. and the offices are closing. That's what it is important to have a good relationship with your pediatrician. And when you have any of these instances, have the ability and the disponibility of calling them, discussing that with them, and then they can give you the proper advice.
You know it's true, Sierra. They always get sick Sunday night or Saturday night, and you're like, what do I do?
Well,
Most pediatricians are available to you.
that's actually an excellent point you brought up. We went through something very similar to that when my son was 5 months old. He was having trouble breathing, and that's when there were a lot of RSV cases, going around. So we weren't sure if it was RSV, but he was having a lot of trouble breathing. We spoke with our on-call, the on-call team, who then did recommend us to go into the ER. This is the one and only time we went to the ER. It's as you said, tons of kids in the waiting room, and you're all sitting there together, and you're like, oh gosh, and you're trying to stay away from other people. And then they ended up using this, like, I don't even know what it's called, an industrial level nose sucker.
Oh,
I don't even know what it's called. So yeah, speaking of noses and congestion, can you talk to us a little bit about why infants are so congested that first year, and how it can sometimes lead to ear infections?
Well, yes, I would touch on both.
Yeah.
The congestion, their airways are smaller than in an adult. In an adult, it's easier to breathe and everything, even with congestion. But in a baby, a little bit of congestion just closes the airways, and they are more prone to have more complications. Also, their airway, the lower airways, their lungs, their windpipes, those are also smaller. So they are more prone to get sick with illnesses like RSV, bronchiolitis, and so forth. And that's what leads to that. Also, anatomical differences in babies. We have a tube that drains the fluid from the ears. If the ear gets accumulated with fluid inside in the middle ear, that drains to the throat through that tube. But in an adult or in an older child, that tube is obliqual, so it drains very, very well. So that's why adults rarely have an ear infection. Older kids also rarely have an ear infection. It's almost unheard of in older kids or in adults. But in little babies, ear infections are very common because that tube that drains the fluid from the ears is not obliqual, it's horizontal. So they cannot drain very well. And when they lay down on their backs, that fluid from your runny nose and everything can go straight into the ears, and that's why they are more prone to have ear infections. There are 3 factors for ear infections. One of them is sleeping or laying with the bottle in your mouth, because then the fluid goes right straight to the ear canal. To the middle ear. Then daycare attendance, because you have more exposure. And the last one is smoking exposure. So those are the factors for ear infections.
okay.
Ooh,
Well,
fascinating.
Sierra, we're gonna have to take a break.
Aww.
I know. So we'll jump back into this because there were some pictures of Lila, and you'll see. I mean, those are sort of good examples of what we had to deal with at
Yeah.
4 or 5 months, right? So we'll take a break.
Hope I
here.
answered your question.
Of course. Yeah. No, we have more. Don't worry. So we're taking a break real quick.
We'll be right back.
We'll be right back. Welcome back to Tired Parents Club. I'm with Sierra Langford. I'm going to say your name this time. The last video, I just kept saying Sierra. And
That's
then back
okay.
to Dr. Baxter. We are talking about illnesses and sicknesses in your first year. So, yeah, I brought up some video of Miss Lila. Here she is. She's super cute, but you can see there's pictures of her with her eyes that and when
Glossy.
this happened on a Sunday night, of course. We had some people over, and then all of a sudden her eyes got really big. I thought it was pink eye or something. I was like, how did that happen? We were so nervous, and it blew up so fast with the boogers and the eyes, and we were very concerned. And I was like, should we call? We called our pediatrician and said, don't worry about it if it gets really bad in the next 2 or 3 days. We had an appointment anyways, so we were going to put some drops. I guess that helped. So yeah, what are your thoughts on that? Like, should I have been extra worried? Is that a common thing you were saying?
The eyes or the
Yeah, with the eyes, like it was almost like the boogers were coming out of her eyes. It was very weird.
Correct.
It got swollen.
Correct. Yes, when you have an infection in your face, in your nose, and everything, all your secretions can obviously infect everywhere that you have in your face. Also, some viruses are more prone to also go into the eyes and cause an infection over there that we call conjunctivitis, but it's most commonly known as pink eye, and is sometimes part of the same viral illness that you have. Some of these viral illnesses in the eyes are easily treated with eye drops, antibiotic eye drops, but some of them are associated with ear infections, sinuses infections, or other types of more serious infections that would require the use of an oral antibiotic.
Okay, yeah, we ended up giving it was like a kind of a gel or something, and it just helped. Like when she woke up, it wasn't like shut, basically, because that was scary. We're like, oh, is it going to be
A
shut?
little gel that like dissolves in
Yeah. She didn't enjoy that, but well, baby
One
does.
good trick to put drops on your babies, because they don't like it when you open their eyes and try to put them in there. They are very scared of seeing something strange coming in. Is trying to put them in the little pocket right here, and then turn them sideways, and then open the eye, and they just slide.
Oh, it like rotates into
Ooh,
it.
it just falls right in.
The secrets.
Good tip.
Yeah.
Good
What you
tip.
got here?
So we have to ask you, we brought in some of our devices, I guess you'd call them, that you use, automatic
Yes.
here.
Yes.
And then you
Turn it
have,
on. Press the button.
you want me to turn
Yeah,
it
make the
on?
sound. Just make the sound. You don't have to use it. Oh,
Okay, I'm gonna
it's
turn
pretty
this
scary. Yeah, you gotta go.
Wow, that's intense. And then we've got one of the many manual options here. I've done both. I think Kevin's done both.
Yeah, the videos in here as well with Lila using it.
In your professional opinion, is one better than the other? Are they both pretty much effective, and it's just what you can handle?
They are all effective. They are effective. They are all good. And but I will stick with the cheapest and easiest way to do it, and the most effective, which is the little syringe that you are given when your baby is delivered at the hospital. Those come in that one. They come usually in the package that is open when mom is delivered. Those are the best ones. So those are like gold. Please
Ooh,
hang on to them
good to
and
know.
use them.
See, I grew up
those
with this
are
one.
accessible to anyone. And you can purchase some also on the store, but the ones that they give you at the hospital are the best ones. So hang on to them.
Okay, yeah, that one's good. She likes a good mix of both. Honestly, it depends if we're in a rush sometimes.
Now,
But yeah,
I have to tell you,
yes.
when you are suctioning the nose, one of the most important things is the use of saline solution. You use 4 drops of saline solution in each nostril, let it stay there for a couple of seconds, and then suction with the bulb syringe afterwards. So I always tell my patients, you can do saline without suctioning, but you should not do suctioning without saline.
Okay.
Just suctioning without the use of saline is probably not very helpful. But when you use saline, that dissolves the mucus and allows it to come out in a easier way.
Loosens
It
it all
just
up.
facilitates
Yeah.
the procedure.
Yeah, because it's just hard, right? And the sucking just isn't
Yes.
going to work.
So the plain use of saline solution is much better than anything else.
Okay. Yeah, I've
Certainly,
seen the novel.
We're snot
Help more.
experts
But
now.
again,
Yes.
use of saline
All about
is more important. You can suction with saline, but you cannot suction without saline.
There you go, Kevin. Make sure you have some saline.
I will.
So this is also sickness related. Obviously, that's this entire episode. When you're taking your baby's temperature that first year, you want to make sure you're getting an accurate reading, and there's all different kinds of ways to do it. What's the best way that you recommend, I guess, depending on the age, where to take the temperature, how to take the
Absolutely.
temperature?
Depending on the age.
Ask
But
Sierra, is it going in the
your
butt or the
baby
armpit?
Yes, this is the thing. The best thermometer that there is, I always told you, is the parent. You know when your baby has a fever. But if you want to rely on a device, the best way to take a temperature on a baby, a newborn, all the way up to a year old, is rectal. There is nothing better than rectal temperature, the most accurate way
Absolutely.
to do it. Once the baby can have an oral thermometer, that would be the second best. You have very expensive thermometers, the Thermoscan, the ear, and those ones are the most expensive and the less reliable ones. So do not rely on those ones. I will never advise to use those ones.
Those are the ones that like you scan the forehead.
Correct, correct.
Oh, so those aren't really that
No,
accurate.
they are expensive. They are not good. The best one is the cheapest one. That one is good. That one that you show over there, that's a good option. But I prefer the old fashioned $1, $2 thermometers. Those are the best ones.
Honestly, I'm learning so much because as moms and parents,
Mhm.
you know, you get bombarded, especially on social media, with all of these gadgets that other, you know, social media influencer moms make you think that you need this and that. And so it's just really nice to hear that the old fashioned, you know, most
Yes,
affordable
absolutely. And remember
thermometer
that
is
as
going to do the trick.
yes, and as pediatricians who also deal with all kinds of people, some people who cannot afford to buy the most expensive ones. And I always tell them, even the most expensive one is the less reliable. So you don't need to spend your money on that.
All right, cool. Now we got
That's-
money saving tips. This is
know.
great. Yeah. Hey, we're gonna take a quick break again. We're gonna come right back, and then you can answer some more questions. We have some more myths. We're gonna go through myths as well. So
Ooh.
we'll be right back. Welcome everybody back to Tired Parents Club. I'm with Sierra Langford. We have Dr. Paxter. We are still talking about sicknesses in your first year and when to be afraid. So let's
Be
see.
very afraid. Just
So-
kidding.
So, so we have daycare, right? Daycare is apparently everyone's going to get sick. I'm going to get sick. You're going to get sick. Everyone gets sick. I have a coworker here that says she has a nanny and their baby never gets sick. Is that true? Is that good?
It is true. It is true. And one of the myths is that they think that if you put your baby on daycare, he's going to be exposed to all these germs. His immune is going to be stronger. That's not true. Babies, if you can avoid being in a daycare and you can have a nanny or a home daycare, that's a better option because you have less exposure. But yes, that would be the answer to that. You know, sometimes when babies are young, like the first month of life and everything, especially in this time of the year, then there's many gatherings at church, Christmas, Thanksgiving, and everything. I try to advise to avoid all those gatherings because there is always someone who has an allergy, has a sniffle, but his pediatrician or his doctor has given them antibiotics and they are no longer contagious. And that's not true. And they are just transmitting some illnesses and the kids get sick. So the less they are exposed, especially the younger, to a larger crowds, the better.
Okay, so like planes and stuff like that too. I guess we
I-
we kind of got like cooked up. We were like, we got to go visit family and stuff like that, and we weren't scared to take Lila out. But I don't know.
Now
if
that
that's
we have
advisable.
FaceTime in better ways like this type of communication, which we can be in 3 different places and still communicate, I think you can show your babies to everybody and everybody can see all their beautiful things that they are doing without actually seeing them, especially if they have any conditions,
But
illnesses.
look at those cheeks. They must be pinched
Yeah.
by family members. That's what they want.
Is there a way to completely, avoid your children getting sick? So like let's say if they're not in daycare and they eventually go into school, 4 years old, I get for pre-K. What typically happens then? Do you ever see kids around that age getting sick more because they
Yes.
weren't in daycare?
Yes. No, they are not going to be more sick compared to a kid who has been on daycare. That is not true. But they are going to have the fair share of some illnesses. But at that time, once they are in school age, we educate them in ways to prevent this, like try not to get too close to other people, wash your hands all the time before you eat or before don't bring your hands to your mouth. And the education to prevent illnesses is very, very important at that age.
That's great to know. Yeah, my son is in school and they're really really on it with the hand washing. That's the first thing he has to do as soon
It's
as
the
he
most
walks
important.
into.
And now that we have hand sanitizers, that's one thing. And I'm glad that you mentioned that because hand sanitizers is like when you go to a restaurant, you don't bring your toothbrush with you, so you cannot use it. You use have some gum. That's the second best. But if you're at home, you're not going to use gum. You're going to use your toothbrush. So that's the same principle that you use for hand washing. Hand washing is the best thing you can do. Use of hand sanitizers is the second best. So you're at home or even in the doctor's offices. If I'm here in my office, I don't use the hand sanitizer. I wash my hands with soap and running water. But if I don't have access to it, then the hand sanitizer is a good option.
See, the simplest thing.
Yeah.
Okay, so we got to ask, and we know this can be a hot button issue, which
topic.
it really shouldn't be, right? But can you go over the recommended vaccinations that infants should get their first year of life?
Yes, and this is very important, and it's significant because I would mention one that is probably going to be the one that is going to make the most impact, and is the one that has the pertussis vaccine. The other ones are equally important, but this is probably the one that will make more impact, and is the pertussis vaccine. The pertussis vaccine prevents what we call the whooping cough. Whooping cough, we still see cases of that. And when you have whooping cough, you have a cough that will last for about a minute. And you just cough and cough and cough for the time that you're coughing, you cannot breathe. Those kids then become turn blue or purplish because they are not breathing. They are not able to bring oxygen to their lungs during that period of time. That can cause some brain damage. They can suffer a lot with this illness. They have to be hospitalized. That's called pertussis. You need 3 vaccines of those to be immune. So you have your first one at 2 months, your second one at 4 months, and the third one at 6 months. So basically, you cannot be immune, even if you go all your vaccines in the way we recommend them. You cannot have a baby immune to pertussis until he is 6 months or she is 6 months. So that leaves the responsibility to everyone else in the community to be immunized against pertussis, so you cannot give it to your child. So pertussis in an older child can be just a little sniffle, or in an older person can just be a little headache, or be something, I think I'm just coming down with something, I don't know what it is. So you would not be really, really sick. But the baby who's 6 months or younger could even die from that. Wow. So that brings the responsibility of that to the other people to get immunized so that you don't put that baby at risk.
Yeah, I remember our parents. I'm trying to remember when Liam was born. I believe we had very close members of our family. I'm trying to remember. My memory is so foggy. I believe we had very close members of our family, like my parents and my siblings, get it because they were going to be around the baby.
So you allow me, the way you protect those babies is immunizing everyone else.
Yep.
So all the older kids that are around this baby had already had their pertussis vaccine. The teenagers have had the Tdap, which has pertussis, and the adults, when they get the tetanus, when I go to tell new parents, I say, make sure mom has their pertussis vaccine. So is daddy, so is grandma, so is everyone else who's going to be around this baby.
Yeah, and that's hard to do, to get everybody on a plane to do that, I guess. So when you're traveling.
No, but excellent point.
No, that's a good point. What is the weirdest myth, I guess, that you've heard in your years of doing this?
The most controversial and the weirdest thing that I have heard is that a vaccine causes autism. That has been debunked scientifically, but it continues to be an issue. And it continues to be an issue because the one who brought this up to begin with did a research paper in which, unfortunately, the colleague who did this lied on the paper. But that just, and it's demonstrated now, it's scientifically proven. But unfortunately, that led to us believing that for all or ever. And that leads to all the controversy. And I suffer for all my patients who have autism. The only thing is that didn't cause it. And that the cause is different. But anyways, you asked me what would be the most difficult. That has been heartbreaking to me, because then my patients obviously are concerned for their kids. Yeah. They have legitimate concerns for them.
And then they're avoiding necessary vaccines, right? And ones that you recommend for people to get.
Yes.
So, all right. Well, thank you so much, Dr. Paxter. You're very smart, very helpful. We both learned a lot, so I appreciate it. We'll say bye to you for now. Thank you so much for joining
Thank
us.
you.
Thank you so much.
Sarah, we're gonna sign off for now. And until next time, we'll be back. And thank you guys for joining the Tired Parents Club.
Queen City News Plus. Just search Queen City News on your smart TV's app store.